I'm called Annettee Nakimuli. I'm an associate professor of obstetrics and gynecology and the Dean School of Medicine at Makerere University in Uganda. Uganda, just like most of sub-Saharan Africa, has the highest burden of maternal death, with 66% of maternal death happening in sub-Saharan Africa. And also there is a very high burden of newborn death. We've been trying to address this burden by addressing the common causes. And one of these common causes of death is a condition called pre-eclampsia, which is a pregnancy complication that is characterized by mother developing high blood pressure during pregnancy. This condition is a second leading cause of maternal death in Uganda and in most of sub-Saharan Africa. The $1 million Calestas Juma Fellowship grant will be used to address pre-eclampsia, a common problem in my community. Addressing this problem usually requires that mothers are assessed for risk, and those who are at risk are made to come close to hospitals but also cared for more closely throughout pregnancy. In addition to that, there are some interventions which can be provided for those who are considered high risk. This has been the way the high income settings have managed to reduce the death due to this problem. In this study, we shall recruit 4,000 pregnant women and follow them up at 5 time points during pregnancy till delivery. At each time point of follow-up, we shall collect clinical information, blood samples, and also ultrasound information in order to assess how the baby is growing. After collecting this data, we shall run some laboratory tests to look out for biological factors that can be associated with the Great Obstetric Syndrome. We shall also analyze this information to be able to identify which women are at risk of developing these complications of pregnancy. And thereafter, we hope to identify which types of women would benefit from interventions that would prevent or delay onset of these pregnancy complications. This research is important for Africa as a continent because most of the maternal deaths happen in Africa. It is 8 times more likely for a newborn to die in Africa than elsewhere. Addressing this problem, which is very common in Africa, is important because then we address it in the context where it most happens, but also we develop tailor-made solutions. Despite us in Africa having the highest burden of maternal complications and newborn complications like pre-eclampsia, that is where least research on this condition is happening. And because of that, we continue seeing mothers and newborns dying without getting life-saving interventions. As a mother, I look forward to a time when no woman loses her life when giving life.